Welcome back to SaharaTV. Today we're talking about something that is very important, and it is your health. And to join me in that discussion today, we have in studio Mr. Charles Cooper. He is the organizer of the African Community Health Series. Welcome to SaharaTV.
Thank you, Tracy. It's my pleasure to be here.
Thank you very much. So the issue of health in the African community, in the diaspora, is important, and it is often sometimes not even talked about.
Yeah, you're right. And imagine that, right? What you just said. It's not talked about. In the African community, it's far worse. You know, there's this stigma with being sick or being ill. And we really need to move past that. Because with New York being, you know, this metropolitan place in which different race and groups come here, there's over 200,000 Africans in New York City. And there's, you know, there's different illness that, being a city, you know, changing diet and so forth, that besiege us. And it's one of those things that we need to start talking about it, and we need to get to the bottom of it. And part of it is sharing information.
That's true. So talk to me a little bit about the African Community Health Series that you organize. What is it? What do you guys do? And how do you get the word out about health?
Well, the African Community Health Series is a series of events, of forums to discuss different things, from hypertension to kidney donation to how to eat healthy, etc. We're trying to get the word out in the different African communities, from the Malian to the Liberian to the Sierra Leonean to the Ghanaians and so forth. So we're working with different community leaders in order to accomplish that and to impact the community. I think it's one of those things that, you know, we talk about different things, but there's such, I go back to that word, there's such a large stigma on health. And a lot of the illness that folks have, there's answers to it. But folks, you know, don't feel comfortable sharing the information. And we just want to let folks know that it's okay.
So how has the community throughout your different populations, how have they been receiving the community series?
Well, there's been very supportive. Community leaders have come out, especially around this Mama Duquesne search for kidney.
Which I want you to talk about that too,
Okay.
but you can finish and then.
Okay, well, because they realize, you know what, it's one of those things that everyone thinks that, you know, it's negative. You know, it's more the fear of going through with it. But once folks are exposed and folks see, oh, you know what, it's okay, I can talk about being ill. It's okay, I can talk about having high blood pressure or hypertension. It's okay, I can talk about my glaucoma. It's okay, you know, because there's other folks in the community that's going through the same situation, and there's an answer to it. And, you know, being New York being a large immigrant community, you know, we come from the continent with our own home remedy also. And sometimes that may not be the best method.
Right.
And
So there's an issue that is happening right now that you are organizing, and it's called the Friends of Mama Duquesne,
Yes.
which you just mentioned him, and he is in need of a kidney.
Yes.
Can you talk about what's going on with that?
you know,
and who he is?
Let me bring it back just a little bit.
Please.
Mama Duquesne is a community leader in the Malian community, very active. He chairs the Taxi Cab Association, etc. There's another community leader by the name of Ara Ameni.
We know her.
Rich. She's very active. She found out that he was ill. His kidney had given up, and he was going to be put on dialysis. And you know, she automatically called on community leaders such as myself to see what we can do in order to get the word out, but also to support him, to come together in this form of solidarity and promote kidney donation and possibly find a match for Mama Duquesne. And you'll be surprised, folks have come from everywhere, and not just in the African community. Don't get me wrong, it's great that, you know, we've gotten the support from the African community, but all over. So it's one of those things that, you know, all it takes is one person.
That's true. So you're holding a forum and a rally on this Saturday, October 26th,
Yes,
right?
we are.
What's going to happen there?
We're going to have speakers speaking about health, speaking about kidney donation, talking about the process. Also, precaution is very, very important. So we're going to have physicians there talking about we can do on our end, so we don't get ill. And then we're hoping that Mamadou, he's feeling somewhat okay to speak as well.
Okay.
And he'll be represented by friends and family, and they will speak about him. So it's going to be a huge rally at the Malian Cultural Center in Harlem on 133rd and 8th Avenue. If I can get you the exact information.
Of course, and we'll definitely share it.
Yeah.
So at the rally, do you guys plan to, I don't know, are you hoping that people can come forward to
Yes.
offer their kidney?
Yes, we are. We are. We're hoping that folks come forward, folks get tested to see whether they're a match to Mamadou King. And in addition to that, to get the information out. And there's other, I'm pretty sure this is what you're going to have happen. You're going to have other folks or they may know other people in the community that may need kidney donation. And I think this is wonderful, because now they will reach out to them, and we may not only be able to find a match for Mamadou King, but we may be able to find a match for someone else in the community. And this is a domino effect. So folks don't have to wait 5-10 years. Sometimes people don't make it because the list is so long. Interesting statistic I just want to share with you.
Sure.
But there's with African American and Africans, there's a 3-to-1 chance that they're on the waiting list far longer than any other groups. And part of it has to do with the stigma, right? Them actually coming out and saying to their friends and family, listen, I'm ill, I need your help. How can we mobilize around this situation? So that's what we're doing. I think the biggest thing at the end of the day, if we destigmatize this and let folks know that it's okay, and it's okay to come forward, and you'll be perfectly fine if you donate one of your kidneys.
That's another stigma.
Yeah.
Like people think that, oh my God, my kidney.
And that's not the case. That's not the case. I always say it's similar to donating blood, and the impact that that you would have on that person and that family will be
Great, yeah.
of course.
So how have things changed since you've been organizing the series? Have people come out more, and have people opened up more about their health? What have you seen?
Well, what I've seen is.
Or is it still sort of something that is, you're trying to get people to open up?
No, it's transformational. I've seen leaders in various community ask what they can do on their end. They've come forward. It's brought the community a lot closer, and it's unfortunately, it takes a tragedy to bring people together. But this is one thing that when we look back about 5, 10, 20, 40 years from now, we'll see that this has impacted the community, and this is something that will not end after Mamadou King get his kidney, but will continue because it's not. When I was growing up, my mother always used to say, one person problem is not just that one person problem; it's everyone's problem, and making that change in the community impacts the psyche, of those there. So
it's true. So talk about like your background a little bit. I know that you are a Liberian.
Yes.
How did you sort of get into the field of organizing communities for the sake of health, African communities?
Well, I've always looked to mobilize the community, whether socially, economically, politically. I've done that majority of my life. I currently serve on the Bronx Borough President African Advisory Council, in which we serve as a resource for the 80,000 Africans that live in the Bronx. prior to that, it's about the need in the community. I've been helped, and I just see it as, it's up to me and those that are fortunate enough to now give back.
Yep. So there's an issue now. Obamacare has opened up.
Oh Lord.
And people have ways of getting help now. But what about the people who don't have papers?
But yes, I'm glad you brought that up. I'm glad you brought that up, Tracy, because that's one of the questions that we face. Because there's a lot of groups, including the Africans, which there's numbers in our community that don't have their papers. So we're all happy that Obamacare is there, but it doesn't cover them. So how can we make Obamacare more inclusive? And that's some of the discussion that's in the community. Is okay, well, we need to start petitions. So there's petitions out already. We're getting different community groups together to speak on the subject and reach our elected officials, and eventually create some type of change here, because New York, it's in itself, it's its own country. When you look at per capita spent, when you look at population, the GDP of New York is larger than most African countries, and I would even say most European countries as well. So we actually set the standards for the rest of the country. So it's a big shoes to put on.
It's true.
But we're here, and we have to, we have to stay active in the community. We have to tackle hard issues that may not be comfortable for everyone, or for the majority, but it needs to be done.
Right. So what is out there for people who don't have papers and they're sick? Are there any programs that people can go to get help? I mean, what do people do when they're sick and they don't have papers?
Well, the great thing about New York City is there are clinics, there are community clinics, but there's not enough community clinics, I'll be honest with you. And that's something that we're in discussion with our elected officials on how we can change that. Because you can't always run to the emergency room.
Because it's so expensive.
Of course, it's so expensive.
Yeah.
And so with that said, we have to work on how we can actually get health care to the people on the ground. Yeah,
it's true. I was speaking to, and I'll start to wrap up here, but I was speaking to Imam Solomon Koneti.
Yes.
And he was telling me that there's a program, and maybe you know more about this, where anyone can come. All you have to do is show proof of ID, some sort of form of ID, and proof of address, and then you can get medical help. And that's something that I believe that mosque on 116th Street has sort of created. I'm wondering if you know about this.
Yes.
You know about it? Because
yes.
I would love for you to share that information, because then again, sometimes people are comfortable when they're around people that they know or their own type of people. So can you maybe suggest some places like that where people can go and get help? The emergency room is so expensive. We know that there's Harlem Hospital, but Harlem Hospital can be a trip.
Yeah.
So anything.
That's one of, I would touch on that, but I just want to say something quickly.
Sure.
That's something that a lot of the religious institutions are moving towards, in which they're looking to partner up with health clinics or create their own health clinics, which at the end of the day is probably one of the best models out there, because your congregation, and people go to that religious institution for a sense of security, a sense of self, and of course some get healed by the hands, but sometimes you need to see a doctor.
Yes.
So that's something that we're looking to push forward with the next administration, to look at the possibility of creating even more of those clinics that are additional resource to the religious institution. Regarding those clinics that you mentioned, you can get that information from 311, and they're all over the city. But like I said, there's not enough. There's really not enough.
And then people need to open themselves up to, I guess, trying to search for other places.
Yeah, but like I always say, it's incumbent upon our elected officials, because that's what we elect them for, city council persons and so forth, to get the information out to the community.
It's true.
And us community leaders as well. We must work in partnership.
Fantastic. Well, we really commend the work that you are doing.
Thank you, Tracy.
And we hope that we can get our brothers and sisters together to just pay attention to their health and start speaking out about it.
And then hopefully I get to see you at Duquesne event this Saturday from 2 to 5.
Exactly. And then we'll try to put that information up online so that we can share it with people out there. So yes, thank you very much for joining us.
Thank you. It's a pleasure.
Great. So stay tuned, guys. We have so much more coming up. We'll be right back.